everybody. I'm Irene Kawanabe with the National Conference of State Legislators, and today I have with me Representative Kyle Yamashita from House District 12, which is Upcountry Maui in the state of Hawaii. Welcome, Representative Yamashita.
Thank you, Irene. Thank you. How are you?
I'm well, thank you. I'd like to start off with some questions today about COVID-19 and the impact on your community. Can you share about how it has impacted your state?
Well, I think at the very beginning, we were trying to organize our plans as far as how to move forward. And so we have, there's eight major islands, but there's 4 counties, and each county addressed it differently. And we're trying to get more coordination from the state level down, but every county wanted to do their own thing. So at the very beginning, it was more trying to get everybody to work together, because everybody really didn't know how to handle it. The state has the Department of Health and that expertise, but the county still felt like they wanted to do their part to address this epidemic that was affecting so many. I don't think we were affected as far as cases as much as other states, especially on the East Coast when it first started. But we knew that if we didn't address it quickly, that it could get out of hand. And early discussions, I think, with the administration and private conversations that we were having with them, the goal was at the very beginning to flatten the curve as much as possible, because the concern was the healthcare system or process wasn't ready for it yet. So how to address the COVID-19, how to ramp up if we did have a surge, do we have enough PPE, do we have enough supplies to test to take care of it, do we have a process to contact trace. All those things were not coordinated yet. So flattening the curve was more about getting the Department of Health and the healthcare providers time to be able to come up with a plan and to be able to ramp up and figure out what we have to do going forward. The problem was that as time went on, we had to think about reopening the economy, and because we told people that we're trying to get the state to like maybe single-digit cases per day, and that was the goal. So everybody has to do their part and stay at home and lock down and do all those things. And when we are talking about reopening, the healthcare system has the capacity to ramp up and to deal with cases quickly and to isolate. Now we have to tell people that if we open up 50 cases a day is kind of okay, but people are kind of stuck in that mindset of we have to stay at single digits, and so that became that is an issue right now as we discuss reopening the economy.
And so I know the Hawaii economy has been hit hard by the lack of tourism. Can you speak a little bit about that?
Yes, so obviously tourism is our #1 industry by far, and especially on the island of Maui, we are, that is our industry. And so we were hit probably the hardest out of all the counties. My understanding is that our unemployment is the highest in the state, and it's also probably, if not the highest, it's like 35, 30, high 30s, getting to the high 30s are unemployed percent. And so we were definitely affected. So there are discussions right now about how do we reopen. So because that's a need, that people are out of work. The 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 federal UI funding and other step-up benefits are going to end at the end of July. So we're concerned about, if there is a continuation of help, how is that going to affect us going forward, especially because towards the end of the year, we know that the state unemployment will, that'll run out because we have 26 weeks of unemployment for people, and then the federal government gave us an additional 13. So that's pretty much right about the end of the year. So that's another date that we're kind of watching, and we're concerned about what's going to happen starting January 1. So that puts a little pressure on. We have to start having a plan to reopen, and that's where we're at right now.
So according to Stop AAPI Hate, there have been over 2,000 instances of hate incidents against Asian Americans across the United States in the wake of COVID-19. What have you seen in your community?
In Hawaii, it's not as bad, I think, because we've always been a community of minorities. And that's how I grew up, where actually when I was young, the Japanese was the largest group. And as time passed, others started to gain, population. And some Japanese Americans in Hawaii moved away. So the balance became even more so equal. And so we kind of grew up in that environment where everybody was always, there was a mixture. And so I don't think we were affected as much as the mainland US. But I think that we are cognizant of what's going on there and pathetic of what's going on. And so discussions are happening more about, more so than I've ever seen in the past of what that means and, how can we participate to make sure that this kind of behavior doesn't happen.
And worldwide, people have seen the death of George Floyd and the resulting protests. How has Hawaii reacted?
Well, there was some peaceful protests. People on every island did some form of it. There was a protest at the Capitol. It was very peaceful. But I think people are now being more aware of what's going on all over the U.S. and because of what they saw in the media and things like that. So I think people want to do something about it, even though it's not, it doesn't happen as much in Hawaii as elsewhere. But I think everybody wants to do their part, and so there's at one time there was protests happening all the time. I think there was one where they did a peaceful protest on Maui where everybody went out on their surfboards and gathered and hold hands in solidarity for that for Black Lives Matter.
And anything from the Asian American and Pacific Islander community or the organizations in Hawaii, have they issued statements or of solidarity or any type of reaction?
I think people have. I don't think it's as public as it is on the mainland, but there are groups making statements, and it doesn't get as much press here, but there is more discussion, like I said, than I've ever seen before.
And so the current COVID-19 pandemic and Black Lives Matter movement has changed the state of the world drastically. What do you think is required of the United States and of the world going forward?
Well, I think that, what's good is it's being discussed and people are talking about it. And, as you know, the Paxil has participated with the other minority caucuses, the Black Caucus, Hispanic Caucus, and the Native American Caucus. And we've discussed this issue for many years. And I think at that level, state legislators, we've had discussions and we've learned to understand what each of our other minority counterparts go through. But at the same time, we also learned where there are similarities that we have to, where we can come together and work together. And, you know, it was happening at our level. But I think what's good now is that it's happening at a national level, even within the private sector, and maybe going beyond. And I think the more people talk about it, I think it'll be something good. I don't think we'll be able to, change overnight, but discussion and people learning about each other is how we resolve these things. I think that's why I believe Hawaii has always been we call it the melting pot of the world, where all the different nationalities come together and learn to live together. And it's because all these different groups grew up together and went to school together and played together. And that's why I think discussion is good, where people will come together and do the same thing, and hopefully it'll be more like us.
And then, so looking ahead to the 2021 legislative session in Hawaii, what do you see are the overall challenges that you guys have ahead of you?
Well, obviously it'll be the economy. And so we're closely monitoring the next iteration of the CARES Act, or what comes out at the federal level. If the next one will have some help for the states, I think that'll be critical. If there's continuing help with unemployment and other services, I think that's important. Because we are so dependent on tourism, we need to open. We just got to figure out how to do that safely. I think that if we don't, there'll be definite economic impacts, but also there are some social impacts that the media doesn't really pick up. But domestic violence is up, child abuse is up, and those kind of things, because they're home and they have no way to. Before, the escape was going to school or going to work, but now they're stuck at home, and so. I think we have to be cognizant that staying at home and being shut down, there are other impacts other than the economy. Like I said, it's something that we've been following here. I don't know if other states are, but it's something that we've been following.
Right. No, I've definitely heard about that in other states, and those are very good points about quarantine isn't the same for everybody. And then what about you? What initiatives or bills are you planning to move forward in 2021?
Well, I don't think there's really initiatives. I think it's more we're going to be looking at what we need to do going forward as far as the state coffers are definitely going to be affected. Small business is hurting. It's all the ancillary attachments to tourism that restaurants and people that sell gifts and different things, they all are attractions, right? They're all being affected. So, the state, well, let's see, there's several economists that told us that what we can expect at best is, even if we were able to open up the economy and say, okay, everybody come and Hawaii's open for business. At best, we expect maybe a third of the people to come back. There was, as far as numbers, on average is about 30,000 people coming in per week, and that number will probably drop to maybe at best 10,000. So we don't think that many businesses will be able to survive at that level. Many of them will either need to shut their doors or restructure how they operate. And so, what we got to figure out is how to keep them in business, and how to that's going to be the hard part. Is what do we do to just keep these guys afloat? And we expect other social needs to grow as unemployment insurance and the federal help from the federal government goes away. We will definitely be affected in our budget. So we're looking at where we can cut. And, if we do cut, that again affects, GDP and how much we're actually moving through the economy, because the state government government in general in Hawaii, whether it's the federal, state, and county levels, is another big engine for the state. And so if we cut, it'll definitely affect us. So we have to balance that. As far as specific things that we'll be addressing in legislation, I can't say right now, because what's going to affect that decision is what kind of help we get from the federal government, and then we just got to work off of that.
Well, Representative Yamashita, thank you very much for sharing your thoughts with us today. We appreciate your time.
Okay, thank you very much.